Hi, everybody. Welcome to the UEA Nursing Podcast. My name is Joe Ellis-Gage, and today we have Steph, one of our students who's come in. Hi, Steph.
Hello.
Thank you for coming in to speak to us. So today we're going to talk about accessing the sort of different support services that the university offer to support students throughout their programme. So before we go into what all that means and have a discussion about it, give us a really brief introduction. Who are you?
So my name is Steph, and I am a second year adult nursing student.
Fantastic. Brilliant. So yeah, just started into your second year.
Yes.
Very
just
excited.
Started this week.
Slightly overwhelmed.
Yes.
But
yeah, getting back into it all after the summer is a little bit. Woo.
Yeah. So you said you had a long holiday and suddenly have to get back into it. It's hard.
Yeah. That initial getting back into routine, getting up in the morning and getting into the uni.
So we should give you shorter holidays. Then you haven't got to get back into it so much.
Yeah.
Maybe that's the answer.
Oh, it might not go down very well.
Okay. So second year adult nurse. So really good person to speak about this, and you've sort of volunteered yourself to come and do it.
Yeah.
Because you've literally just gone through that first year, and sometimes that first year at uni is the one that takes the most transition. It's the biggest one to deal with because of the change from living at home or studying at school to suddenly being at university, different pressures.
Yes, definitely a big jump.
Yeah, it is a big jump. So it's really good to have someone who's just experienced it to come and speak to us about it. So what we're going to discuss is there's a whole host of different support services that are available at the university. We're not going to go into every single one. We're going to talk about your time over the last year and what you've done, what services have supported you, and how that's kind of worked for you.
Yes.
And clearly it's worked for you because you're still here at the start of year two.
Yep, I made it through.
Excellent, yeah. So I guess let's start by saying you started just over a year ago.
Yeah.
Were you even aware of what support services were available at the time that you started?
Not really. Like, I knew a little bit about it. Like, before I started, I did a little bit of research into it because I came in knowing I needed some support. I had a little look, but I had no idea of the extent of how much there was and what you can refer yourself to. So that was quite a good shock, really, to know there's so much there.
So you knew there was something. There was enough to give it a bit of confidence that when you started, you knew you'd have some help, but you didn't really know too much about it.
No.
Yeah. Okay. And you said you knew that you would potentially need some. Why was that?
So back when I was probably about 16, when I first went to college after school, I got diagnosed with anxiety and things. So throughout my life, I'm now 25, I sort of knew that, okay, I might need some support in that.
Yeah.
And before I came to the university, I actually did an access to higher education course. And I had an exam needs assessment and everything to do with that. And they got me some support. And they said, when you go to university, mention it because they can take across your exam needs and everything. So that was my main sort of reason that I wanted to speak to somebody.
Yeah.
Mainly, first of all, was to just get my exam needs set and ready and my assessment needs. But from there, it actually branched onto a lot more that I could access.
Yeah. So your initial concerns were, I've got to have assignments and assessments and examinations, and I want to make sure I've got all the systems in place that I get what I'm allowed to have considered for it.
Yeah, absolutely.
But actually, on reflection, probably there's lots more broader support you didn't even know you needed at that point when you started.
Exactly, yeah. I didn't know what the transition to university was going to be like and everything, changing from college over to that. And I've been working full-time before as well, so that was another big transition in my life, from working, going into studying again. So that was all quite a lot happening at once. Yeah,
and for everybody, and people get bored of me saying it, and I keep saying it, this is a really hard course.
Yes.
It's not unachievable, but there's a lot of pressure on you. You've got there's assignments.
A lot of taught learning, a lot of being in class, and a lot of obviously on placement as well, doing your full-time hours on placement. It is a lot.
Yeah, so then you've got the professional registration to worry about and the degree, and it's all kind of all in one, but it's a big deal to take on.
Absolutely.
So if you add in a few extra challenges that you may have over someone else, you need that support.
Definitely. Otherwise it can become quite overwhelming.
Yeah.
So
tell me kind of your story of how you started. So you knew the systems were in place, but you didn't really know what they were. You came and started just over a year ago.
Yeah.
What happened next?
So one of the first things that happened was my advisor sort of emailed me and the other advisees and said, let's have a meeting, let's get to know you a little bit. So when I met my advisor for the first time, I kind of mentioned, you know, that I'd had this put in place, but that I had diagnoses of mental health conditions, and they picked up on possible dyspraxia and things like that as well.
Okay.
And she sort of said, well, have you thought about going to like the wellbeing and things? Do you know what that is? And I said no.
Yeah.
So she kind of explained, well, they do like talking therapies and everything. They have like disability support. So I kind of had that in the back of my mind. And also at the beginning of the year, the uni actually did a lecture for us all. They got the wellbeing teams in, the learning enhancement teams, and they came in to speak to us as a whole cohort and said, these are available to you. You just need to ask.
Yeah.
And I think that's the biggest challenge, is asking. Because at first everyone's like, I can do this, I'll be fine. But then you start thinking, well, actually, am I okay?
Yeah.
Do I think I need some support? And that was the biggest anxiety about it, was kind of saying, I think I need the help.
Yeah, and that's a bit of a realisation for a lot of students, because I think that we get the wellbeing team into that first week or two at uni. They come and do a talk, and I'd say probably 80% of the group sat there going, oh, this is great for the people that need it.
Yeah.
That's not me.
Yeah,
But-
you kind of think, oh, I don't need that, I'll be fine.
Yeah.
But actually.
And you might not need it there and then.
No.
But in 6 months' time or a year's time,
Yeah.
you may need it.
Some people, when their first assignment's coming up, if you start placement, and some placement if you're getting overwhelmed by it, or the examinations are coming up, the assignments, anything really can sort of be that hone-in moment, and like, well, actually, I think I'd benefit from talking to somebody.
Yeah. I've never had anyone who's become worse through talking to somebody about it. So,
No.
so yeah, that's always a good way of looking at it. So when did you first make contact with the wellbeing team?
Probably about 2 months in.
Yeah.
When like the first assignments started sort of propping up, and then they were talking about going out on placement after Christmas. And I was like, well, actually, I think I would benefit from just having a chat with somebody about how I'm feeling. So I took that big step and put that self-referral in.
Yeah.
And they were very quick to get back to me and said, we've got you an appointment with somebody for a single session talking therapy. So that was really good to know that you can access it so quickly. I didn't expect that fast a turnaround.
Yeah. How quickly do they reply, and how quickly were you in?
I literally got an email the next day saying, we've got your appointment in the next week.
Brilliant.
So that was really good to know that I wasn't having to sit on this issue for ages and ages waiting to speak to somebody, that I could just get it off my chest.
Yeah.
And that was really good. I just sort of explained, you know, I've got assignments coming up and placements coming up, and it's all just getting a little bit much. I'd moved out of home, so I was living on UE accommodation.
Yeah.
So that was like, I'm living away from home. It's all very daunting. And we just sort of spoke through that and had a chat, and they said, well, there's things we can put in place.
Okay.
So they wrote to my advisor and said, this is what we've spoken about, because she asked if she was happy for me to discuss that with her. I said, yep, absolutely. So they had a chat with that and put some recommendations in. So we then made the decision to draft me up a reasonable adjustments plan.
Okay.
And that just came from that one appointment, which was amazing, which meant that academically and on placement, everybody was on the same page about me and what I needed from them in order to succeed.
Yeah, which kind of just meant you got a bit of consistency.
Absolutely.
And you didn't have to keep starting the conversation up again about what support you need, because you had that plan.
Yeah, you just have that one document and you just send it to them and say, here you go, have a read.
And what sort of stuff did it say?
So it said that I was entitled to have rest breaks if I needed them, both in theory and in practice. So things were just getting a bit overwhelming. I just needed to take 5 minutes. They sort of knew that I would just be able to take myself off, have a quiet moment and come back. They sorted out exam adjustments for me, so I've got extra time in assignments and exams. I've also get extra time to complete and hand in assignments if I need them.
Yeah.
If things are getting a bit overwhelming with deadlines, I can just ask for an extra week or so just to get me through it. And yeah, so there's other things they can add on throughout the year if you think you need them as well. So I found that at one point I was like, well, actually, I think I might benefit from like shorter shifts but more days. And for that, they sort of sent me to Occupational Health, which again isn't something to be scared of.
No.
It's to help you. And from that, they then said, we can get you things like the shorter shifts and things. Let's
come back and talk about occupational health in a minute, because I think that's an important one to consider, and I don't want to forget about it. But I was going to say, you had your first appointment, your one really quickly after you requested it.
Yes.
Did you then say, right, I need regular appointments? Did they say, here we are, we're here if you need you and you can come back when you need to? Like, what was the next step, and did you see them again?
I did see them again. So they said they offer them as like single sessions so that everybody's got the ability to access them quickly. So they said, just tell us if you need another one. And we can get you in from like 2 or 3 weeks after the initial one.
Yeah.
And as the year went on, I had my ups, I had my downs. And when I had my downs, they said, okay, I think you'd benefit from seeing somebody one-to-one more frequently. So they put me with like a named advisor, because that was when I was feeling pretty rubbish in myself, to be honest. And they thought I'd benefit from having that sort of like in contact, and that was more higher need really. So she would email me and ask me how I'm doing, and she would report back to my advisor how I was doing. If I wanted her to as well. And that was a bit more structured, which what I needed at the time.
Yeah.
But then when I was starting to sort of recover from that blip, we went back to just having it as and when I needed. So they kind of tailored it to what I needed. Because generically they do advertise it, it is one-offs, but you can request more.
Yeah.
But if they do think you need more and you think you need more, they can facilitate it. Absolutely.
So they try and do the one-off thing, so that way they've got more capacity to see everybody for that one-off, do that assessment and see what people's needs are.
Yeah, exactly. Yeah. And there was times where I would just have a one-off, and then I just say in a week or two's time, actually, yeah, I think I benefit from another, and then they just put me through again. So that was really flexible.
Okay. And so you've mentioned your advisor quite a lot. They've kind of contacted your advisor, and you did. Did you find you had the support from them that you needed? Yeah,
definitely. We'd have like Teams meetings, or I could come in and speak to her, and we'd have a chat and sort of say, how are things? What can we do for you? It was good for assignments if I needed extensions. Then if I needed longer than a week, obviously you present evidence. But if you've spoken to somebody from the wellbeing or advisor and said, I am struggling, I need longer, they can help sort of facilitate that and evidence that you've sought support.
Okay.
So that if you need longer, like they know why, because obviously the deadlines are there for a reason. But if you are genuinely having a hard time, they can make sure that you get an equal opportunity to get things in. Yeah, and if you've
been regularly checking in with an advisor and the wellbeing team and clearly have been struggling, that supports your evidence to request a...
Exactly, yeah. So that means that you still get your fair chance. But then because you're also sort of saying, well, I don't want to feel rubbish. I want to feel better and I want to get through the course. So it's a good way of also showing your commitment, because that was my biggest fear, was having mental health difficulties, being like, are they going to say, have problems with having a break in studies or anything? But at no point it was like, they never said you won't be able to do the course or anything. It was very much empowering me.
Okay. Well, that's good.
You can do it.
Well, that's because that was going to be my next question was, at any point, either prior to you making that self-referral or once you were in the system, did you feel apprehensive about it? Were you worried because you're on a professional registration kind of course that it would impact on that?
Yeah, definitely. Like, it was quite a big fear, because I have support from the university and through the NHS, and I was thinking, oh gosh, what is it going to be like saying I'm a student nurse struggling?
Yeah.
But at all times they were just saying, we're here to support you. We want you to get through the course. We want you to become a registered nurse. It was very much like trying to pick me up when I was feeling down. And that was really, really amazing of them, just to keep like pushing me gently to say, you can do it. And having somebody there just to validate the fact that, they believe in you can be quite a significant factor in helping you.
Yeah. Yeah. And the whole point of that service, and not just even the wellbeing service, the advisor system, all of us in the university, is to support you to complete what you started, not to put a barrier there to say, you've ticked too many boxes, we're not going to help you now, or you can't do this course. It's, what can we do to help you through? And every now and again, there are students that and need to take a break, and they say, well, I'm not in a position to do this now, and the wellbeing team might have that conversation with them.
Yeah.
But in general, that's a last resort. And
that is very much a last resort. Like I say, I needed quite high need support, and they were still happy for me to keep going, because they could see that I was trying to like make the effort.
You were engaging with them.
Yeah, because I said, I want to be better. I want to become a nurse, and just having somebody to speak to is probably the biggest thing that can help me right now. And it was. So
good. So you mentioned earlier on that you also had adjustments made in terms of like for your assessments and for some of your theory stuff, and you talked about possible dyspraxia and that kind of thing.
Yeah.
So I'm assuming that as well as seeing the wellbeing team, you had some contact with our SpLD team who sort of deal with additional learning needs.
Yeah, so I had a chat with them because I'd already been assessed at college. I was quite like plain sailing. I said, here's my assessment from college. They said I can have 20%, 5% extra time, a reader pen if I want it, etc., rest breaks. And they said, that's fine, we'll stick it on there. So if you've already got an assessment, like it's really quick. But if you haven't, they said, well, we can sort of assess you for extra. And they did offer me, they said, if you want an extra screening to see if there's anything else we can put in place for you, that is something we can do. And I chose to decline because I was happy with everything I had. But if you're not sure if you need support, it's absolutely worth going to them because they can go through everything. It's not to trick you out. It's to see what you need to make sure you've got an equal opportunity in your assignments and your exams. Yeah.
And it's that equal opportunity is a really good way of explaining it because all people have different levels of challenge, but they're all capable of doing the work in the end. They just need a different adjustment in between. So whether that's slightly longer in an exam because they have difficulty in reading and processing the information or whatever it might be, just those adjustments that mean, right, it's effectively a level playing field and everyone has the opportunity to pass if they can.
Yeah, because like all the exams so far for me have been online, but they did say I was entitled to a quiet room. So if I ever had to come in for a face-to-face, it means I haven't got to worry about that the pen's clicking and everything, because that would be quite a big trigger for me. It's hearing everybody else in the room finishing and worrying about when you're being done. So although it is online, they did say, well, we can offer you a quiet room if you ever have to come in for a face-to-face.
And how did you get into that system to be seen?
So that was quite easy. When you apply to university, they have forms and things. So you can do it before you come to the university or once you've started. It's just an online form. You just say, I'd like to be assessed. They ask you a little bit about where you think you might have difficulties, if you've ever had any diagnosis, because you don't have to have any diagnosis to get the support, which I think is the best thing about it. So if you think, oh, well, I might be dyslexic, I struggle with reading, but you haven't been told that, you don't have to like worry about having that to get the support. They'll screen it for you. Yeah,
and that's really important because a lot of things that people, we get a huge amount of students who don't realise they've got any additional needs, and then suddenly we start conversations about dyslexia or autism or ADHD or whatever it might be. But actually, sometimes the process to actually get diagnosed with anything is not quick.
No, absolutely.
But that doesn't hinder you because they say, look, we'll do a screening. We see that you've got an indicator of that, and we can then put the adjustments in. Yeah,
so you don't have to worry about going through that long old process of getting a diagnosis.
By which point your course is finished.
Exactly, with the wait list at the moment. But so that was really beneficial for me because they found the traits of dyspraxia. But obviously, trying to get a diagnosis is quite long. So knowing that I've got that support, and also it's quite helpful for if I wanted to pursue a diagnosis, I can take that somewhere and be like, well, the university have picked this up.
Yeah. So that's quite supportive. And just for clarity, for people who are considering that, they can literally just Google UEA SpLD and it's got a self-referral form on there that they can put themselves in, or they can go to their advisor who will direct them to the same part or put in the referral with them or however they need it.
Yeah, and there's disability advisors as well. So if you're not sure and you just want to talk to somebody, like I've spoken to the disability advisor, and they were lovely. And it just helps you like feel less overwhelmed and less anxious about accessing the support because they are there to help. Yeah.
Okay. So then another system you sort of mentioned is occupational health.
Yes.
So we all students have some contact with occupational health in terms of immunisation assessments and all that kind of stuff when they start. But other students sometimes need an additional appointment with them. Tell us about yours.
So I was very nervous when my advisor said, I'm going to refer you to occupational health. I was like, oh my gosh, what are they going to say? What are they going to do? But there was no need to be worried. They were lovely. They just spoke to me about my diagnoses, about any medications I was on, how they affect me, and what I think I might benefit from as well. So they wanted to hear what I thought. And then they proposed some ideas to me. So they said, well, what we'll do is we'll maybe indicate that you don't work more than 2 days in a row. Because 12.5-hour shifts are long. Yeah. And when you've got a disability or a mental health condition, etc., it can be very taxing. So they said, well, we'll put that in place. And they said I can have my rest breaks. So if I need to take 5 minutes out, I can just say to my assessor, whoever I'm with, I'm just going to take 5 minutes. And they know that it is due to health condition. It's not that I'm just wanting to like stop. It's
Yeah.
and it's all protected as well under the Equality Act, which means that you can take that occupational health assessment, take it to your placement alongside your reasonable adjustments, because that usually gets reflected onto there as well.
Yeah.
And it means that you can get what you require.
Yeah, and it kind of gives you that, just that little bit of security that you haven't got to go and argue a case to get whatever you're entitled to.
Exactly.
It's written down, it's been advised by Occupational Health, therefore that's that. And you haven't got to have that conversation over and over again with new assessors or new supervisors about why.
Yeah, exactly. I've had 2 assessments, and the second one was mainly just to update it. But then if circumstances change, for me, for example, I had a change in medication that affected my sleep.
Okay.
So I went back to them and they said, okay, we'll interim take you off night shifts just whilst I'm adjusting, and we'll look at it again. So it was nothing to be scared of. If you have a health change, because they're not there to stop you or catch you out. It is just making sure that you get in the adjustments that you deserve.
Yeah, again, it's a supportive process and a sort of safety check for you as well, just to make sure that you are well, you've got everything in place that you need to have.
Yeah, absolutely.
So I guess that leads to another question that kind of pulls a lot of what you've said about together, is some people won't know what a reasonable adjustments pack is and how you make one or what it includes. So tell us about yours.
So they break it down into things about anything from mobility to if you've got any specific learning disabilities such as dyslexia and dyspraxia, mental health conditions, and they have an area sort of more based around the academic side and more around the placement side. So my academic area just says I need breast breaks and things like that, whereas I'm out in placement, it says no more than 2 days in a row, breast breaks, currently no night shifts to be reviewed. But if you have got something like a mobility problem, they can issue things like having a personal evacuation plan. If you struggle with stairs and things, kind of like making sure that you get access to buildings that have got lifts and things like that. So it's available to anybody if you have something that you think would benefit from a little bit of support. So even if you just think, I've got just dyslexia, if it's just dyslexia, you can still ask for one.
Yeah.
And it's amazing how much they can actually put on there to support you.
Yeah, and students should stop saying just before whatever their condition or problem might be. Because
exactly.
they're underselling it. Actually, if it might impact on you, then we should consider it.
Yeah, for me, it's just anxiety, but actually it does impact me in my life, and it's a thing I have, and I accept it. And having that, it means that I don't have to go around and keep telling people that. I can just show them it and they will read it. And sometimes my placement have said, I've got a question about it, can we speak to you? But it's more just about making sure they facilitate what I need. Like, I've never had a problem with the placements when they've read my plan. They've just come back to me and said, we've got a question, or we don't have any questions. Do you have any questions for us? Is there anything we need to know? Yeah.
Yeah. And it's about making that placement work for you in terms of it. And sometimes they might have queries because it might say something on the plan and they might say, well, we can't do exactly that. What about this? And they'll have a conversation with you about it. If it's something like a shift pattern request, for instance, but you're working somewhere that's only open on certain days of the week, then they might say, well, we can't do every other day because we don't open on Wednesdays in this surgery or this whatever. However, we could do this. So it sometimes needs a bit of consideration. And you write it, you go through it with your advisor. They can kind of check bits of it with you and discuss it and make sure that it's got everything on there that you need. And it's quite a long form because it's got lots of different sections, and lots of them you'll find most students will have lots of boxes that just say not applicable.
Yes.
And then they'll fill out the bits that are relevant.
Yeah.
And then it has a summary page at the end.
Yeah.
So you can, when you share it with placement, share the summary page that doesn't necessarily give too much information, but it gives the clarity of what is needed. Yeah,
and your advisor should sit with you like mine did and go through it with you, because then you've both got a copy, so that then the lecturers can also access it as well, I was told. So then, like maybe I do need to take some breaks from the lecture, they can see that I've got a reasonable adjustments plan in place.
Yeah, and it's stored securely and it's only accessed if it's necessary. Yeah. But it is there. And the summary page, if you've got extensive medical history, you might not want to share all of it with your supervisor and assessor on placement, but you might need them to know that the adjustments that need to be made. So we just put that on that page.
Yeah, exactly. Because for example, mine just states mental health conditions on my summary, so they don't have to go into the ins and outs of what's going on with me. I'm pretty open about it, but not everybody wants to be.
No, and that's fine. Yeah. So it's good that it's in a way that is supportive to the student rather than just a list of problems or anything like that.
Exactly.
And it's the student's responsibility to share it with placement. So that's an important thing to remember, is that when you start a placement and you do that thing a little while before and you contact them and say, I'm coming to you in a couple of weeks' time, can I have my shift? Is at that point you should be sharing your reasonable adjustments plan and saying, I've got a reasonable adjustments plan. Can that be, can I share that with you?
Definitely let them know as soon as you start making contact with your placement, because that makes it so much more easier, I found.
Yeah.
So then they can make sure your shifts are correct and everything.
Yeah, don't assume that they know about it. We won't have, as because of confidentiality, and it's your plan, it's not our plan, we won't share it without you doing so.
Yeah, because you have got the right not to share it.
Yeah.
But then if you don't share it, you don't get your
you don't get the benefits of it. So. Yeah. So you've given us a really good summary of what you knew at the start, your support through your advisor, accessing the wellbeing team for a one-off appointment, and then some more targeted support later on, referral to the SpLD team, occupational health, and all that, how that kind of all gets put together into a reasonable adjustments plan. How would you say that all of these things have helped over the last year?
It's meant that I've been able to sort of really make my first year the best it can be, because it wasn't easy. I didn't find it easy, but knowing there was somebody there to like say, I need help, or just having someone to talk to, or even just emailing my advisor saying, can we just have a chat? Like, it meant that I had that built up support, and it meant that I felt like I wasn't alone in my struggles. And it was really, like I say, it was really, really good to hear people say, you can do this. And if I hadn't had that, I think I probably wouldn't have made it through.
Yeah.
So.
Yeah, that sort of supportive, sort of reassuring voice for you.
Yeah.
And you've done year one.
Yep.
If you've done that, you can do year two, and it goes on from there, I suppose. And it's important to remember that your support doesn't have to start at the start of your course. It doesn't have to end at a certain point. It's as and when you need it. So some students might be watching this and they might already be in year two and then start feeling like they need support. Or they might have just be in year one, need support in the first 6 months, and then be able to step back and say, I'm all right at the moment. I don't need additional help.
Yeah, that's exactly what I went through. There'd be times where I just made like no contact with anybody and I was fine. I was just getting on. Then there'd be times where I like, I need some help. But it was always, when I said I needed it, they were there. So.
Yeah. Excellent. Well, thank you very much. I think that's kind of given us a really good overview of some of the struggles. I think it gives us a really good in-depth kind of understanding of the different areas of support there is out there. If in doubt, students should go to their advisors, because their advisors can't fix all their problems, but they're really good at signposting to the right level area of support that there is.
Absolutely.
So any doubts, advisor is your first port of call, and they can say, have you tried this? Have you tried that? Would you like a referral to this, to put that in place? And everyone's experience will be different, but I think hopefully it's been reassuring for people that have watched this to know there's lots of support out there, regardless of what your need is. And we haven't even gone into some of the support services that are out there. There's financial support that you can go to. There's the learning enhancement team that can really help focus on academic support. There's lots more out there. But they know that there's support out there, but also they know that this course is achievable and open to everyone who started it, regardless of those challenges that come up.
Absolutely.
So I think when you're the person that's accessing the services, you sometimes think you're the only person accessing the services on your program, and you won't be. So great. Well, thank you very much.
Thank you.
Hopefully you have found this episode interesting, found it useful. If you have, please click like. You can subscribe so you get alerts when there are new videos. And if you've got questions for us, put them in the comments box underneath and explore all the other videos and direct people to it. If you feel there's someone who might benefit from watching this video, then share it with them. And we will see you soon for another episode. Thank you very much. Thanks.
Thank you.